This is the first time we are using a system that documents all the items we use in a surgery.
Operating rooms are our most expensive product line, and until today, we really didn't fully know what was going on.
It's important that the system be user-friendly. The system must work quickly, with minimum time of expensive nursing staff. We can quickly replenish all items and document everything in patients' records, like regulations require.
This equipment, which is the bulk of equipment in a large organization like a hospital, needs to be managed much more precisely and save time on manual labor.
We are in the operating room. The device is small, doesn't take up much room, very user-friendly. I place the item. Let the device snap the image. When it's green, I remove the item. Place another item. The camera snaps. When it turns green, remove. Everything is saved. I see the photos. If there's a mistake, I can cancel. Everything is saved in the patient's record.
There wasn't a connection between the patient's record and the implant, and this system enables it simple and easy.
It's important for the patient and for the future. It's the Ministry of Health's regulations that we know what was used. And if there is an item that is recalled, it's easy to find.
It's revolutionary in my opinion. The greatest advantage is the logistics. Stock management in a department that sees millions of shekels worth of products that in reality, no one knows what happens to these items. We can know if a surgical procedure is overly expensive or if a surgeon's procedures are overly expensive, and someone can ask him to explain. Today, I don't have this information. And what about stock that was ordered and just sits on the shelves? Stock that has expired or not managed correctly? A very large part of our budget goes to surgical supplies, and we'd like to manage it better. In the broader picture of the whole hospital, we'd like to know the true costs of all our activities. How to better budget surgeries, how much the procedure really costs. As a director, this is very important to me. The operating room has been a real black hole. We stock them with supplies and don't know what is used and what is not.
Often, we have situations in which we are missing items because the material management employee just comes and looks at the shelves and sometimes misses things. We've even had to call him in at night. In the past, they tried to implement systems for tracking and reporting. They were not easy to use, and the staff did not cooperate.
All the experiments failed, big time. The usage reporting was near zero. We had huge discrepancies in stock management, and we stopped using them. This time, this system, which is very user-friendly, easily allows us to reach almost 100% reporting. 97%.
This system is excellent. Easy to photograph each item. It reports correctly, and, in the background, computers handle everything.
It's not dependent on our ERP system. If an SKU does not match our master records, the item is transferred to another folder, not to stop the flow of data. It knows how to connect the implant manufacturer's catalog number with our internal SKU, and in our case, also with the GPO's SKU. The system reports items that could not be paired, and our materials coordinator quickly fixes it. We have 10 operating rooms. We added the devices to all rooms on the same day at the same time. They all began reporting immediately.
It took 3 days because we have a large staff to train everyone. And afterwards, there were very few problems.
We've been working with IDENTI for 4 years, I believe. We introduced several devices into our operating rooms that effectively improved our inventory management from end to end. Everything is reported automatically to our suppliers. They replenish on time. We've reduced time and effort to zero. Really zero.